Mrs. Lambert is 59 years old. She lost the use of her legs in a car accident. You need to transfer her to a wheelchair so that she can go for breakfast. The patient lift is used for people who are unable to bear their own weight. It provides full assistance. Ideally, 2 attendants are required for this type of transfer. The PSW has prepared the necessary materials and brings them to the room. The pre-transfer steps were carried out as follows: attendance handbook check, hand hygiene, and user ID verification.
Hello, Mrs. Lambert.
Hi.
Hi, my name is Philip,
Hi, Philip.
and I'm with my colleague Julie.
Hi, Julie.
And we're going to use the lift to be able to lift you out of the bed and place you in your wheelchair so you can go and have some breakfast.
Oh, good. I'm hungry.
Perfect.
The PSWs bring the wheelchair close to the bed and apply the wheel locks. They also bring the patient lift closer. If necessary, they move the bed to create more space, remembering to reapply the wheel locks once the bed has been moved. To help with positioning the sling, the PSWs can ask the user to lean forward. They position the sling at the bottom of the user's back, centering the seat opening. When the 2 sling sections are positioned under the thighs, they cross the small loops together on the inside of the thighs and then pass the larger loops inside the small ones. The PSW brings the patient lift closer. She uses the remote to lower the sling to the user's level, being careful not to strike the user. If there is a second PSW, they can help to secure the apparatus. Once the sling is at the proper level, the PSWs position the shorter loops across the back and the longer ones under the thighs to simulate a sitting position. The remaining loop must be left free as it is used for safety. Once the loops are properly tightened, the user is lifted with the patient lift. The sling must be secured at all times to prevent it from swinging. Once the user has been lifted off the bed, the second PSW grasps the user's legs so that she faces the apparatus. The first PSW moves the patient lift so that the user is suspended directly above the wheelchair. The second PSW uses the sling handles to direct the user. This done, the first PSW lowers the sling until the user is seated. Then, the user is asked to lean forward as the sling is removed.
Okay, I'm going to take the sling off.
Okay.
Make sure it doesn't get tied up in there. So just have you move forward a little bit and I'll pull this right up.
Can you pull down my pants a little bit?
Sure, no problem.
Yeah.
There you go.
Okay.
Once done, the PSWs make sure the user is seated comfortably.
You nice and comfortable like this?
Yeah, I'm fine.
Okay,
Thanks.
so we just
Thank
have
you
to
so
take off the
much.
brakes and you're on your way to breakfast.
Okay, thank you. You guys have a nice day.
Enjoy your day.
Yeah.